Good afternoon, and our project is 100% Tatarstan. And in the frame of this project, we meet the representatives of different fields of industry. And as your establishment is the flagship of our healthcare, and we would like to speak about medical clinical diagnostic center, about healthcare, and what is the difference of your medical center, in what way it is unique and peculiar. It is unique as it is one of the best establishments, medical centers in the Russian Federation, not only in Tatarstan. For us, it is the medical center where the team works with bright eyes. And if we speak about the factors why we are the best, I can say that according to the results of our surgeries, the results are, outcomes are similar to the top 10 clinics in the world. And if you speak, for example, about the academician Shlichtov who visited, and he says that it is clinic number one, as it is a smart hospital in Russian Federation. Well, clinical and informative system that tests the competences, and so we are 5.6 score out of 7, and our team that is really eager to work and really zealous to work reaches and meets the satisfaction of the population, and according to the technologies introduced in the world. And of course, we aim to enter 100 top clinics in the world. Well, why the best? Maybe because of different starting positions, because you are well equipped, you are well funded, when you have cutting edge technologies. You know, the modern world is developing. There is the word material studies. We see the spacecrafts, new automobiles, and they are made because of new alloys, new materials, new metals, and the combination of these elements makes our center unique. Unique from the position of people who lead this or that field, are the leaders in their field, and they create new, and they are not afraid of anything new. And within the short history of 15 years of surgery and 20 years of our existence, any field, neurology, cardiosurgery, people are not afraid of anything new and create from scratch. And this creation is not done by us only. It is just an alloy. It is the tribute of the government. And I can say that when we were opening, the team was waiting for 15 years for self-implementation in their field. Neurologists dreamt of having the instruments and tools and the equipment to make the operations that are unique possible. And our medical clinical center is the achievement in the healthcare service when the team of professionals has got the state-of-the-art technologies, and population are able to receive the services that they couldn't receive previously. And there are surgeries that can't be performed until the equipment is acquired. Well, just to speak in a very trivial way. Well, today the professionalism is based on competences, skills, knowledge, research, and, of course, excellent tools. Of course, professionals should have these excellent tools, and the clinical center is the excellent tools in terms of surgery, cardiosurgery, neurology, abdominal surgery, and all these fields include the composition of emergency help. When getting into medical clinic, you get either into office center or airport terminal, or some terminal for hall for presentations holding. It is very unusual. It doesn't look like a healthcare unit. Why have you chosen this way? Psychologists say that the majority of diseases is humiliation, and the first treatment is respect. That is why respect should start with the first steps from the territory. A person, an employee, a patient, his relatives should feel this empathy, this respectable treatment, and he feels it even tactically. Palpable. It should be palpable. The way staff communicates with him, the way he feels comfortable, and we are patient-oriented. And that is why we focus on and insist on the point that we should show respect. When you go to the medical, to a polyclinic, well, so you are not treated this way, of course. There is no so much respect. But when you feel that you are respected, of course, it breeds the element of trust. And as a result, it brings to good results in treatment and harmonious relations between a patient and a doctor. What is a smart hospital? It is transition to paperless clinic, where all the data are digitized and all the processes are digitalized. The digitalization, deep digitalization with the database storage, with the possibility to form the algorithms, diagnostic survey of perimeters. It opens up huge possibilities, all ultrasound examination, everything. The doctor views me in dynamics. It is in the scale of your medical center, or maybe you communicate with other clinics in the districts, with Republican Clinical Center. Well, of course, we are connected with other clinics through the communicative platforms and integrating programs. We, of course, interact. Why do we strive in the system of healthcare to spread this system around Tatarstan? The health map, when the doctor sees all the events happening to the patient, and it allows to see all the subscriptions. You don't have to polyprognose, and it alleviates the way of ascribing the medicine. It is the data obtaining. It is the focus of individual programs for preventing and health improvement. When will we develop the system in Tatarstan? I spoke with the Minister of Informatization. He told that it is the main problem. I hope in the nearest future, and you are actively working on it. Yes, we do. And another moment we discussed with the minister, he said that the doctor should be a little bit of a computer programmer, and computer programmer should be a little bit of a doctor. Do you have such specialists? I can say that today the most complicated surgeries are carried out as a team. It is not only a doctor, a surgeon who makes an operation. There are 17, 20 people. There are some unique operations, surgeries with teamwork, and the teamwork of multi-profile specialists. And I would say that today a doctor is closer not to the programmer but to the researcher, to the manager, and of course he is an actor as well, because he has to find ways with the patient to be trustworthy, to be a researcher. Maybe it is not very fashionable, and when we see the Moscow doctors through communication carry out surgeons in the distant remote areas, telemedicine, how introduced it is in our life and how effective it is. And how efficient is it? This technology is widely developed, and I should say that Da Vinci robot, which is invented to work remotely through the network and operate and make a surgery even in space. Medicine, what professors do you involve? We interact with our vascular center, with our specialists in districts. in regions through visualization and exchange of telemedical data. We have a collegial consilium of the most complicated cases from the remote district of Tatarstan remote clinic. You consult during operations, during the surgery. Does it happen often? When did it happen last? In neurosurgery and neurology, 5 or 6 times per week. Well, that is really cool. Your surgeons work not only in the clinic but also consult concerning different clinical cases.
International conference this year you've had for the 13th time International Architecture of Health. How did you get this idea, and will you hold it this year? Of course, this year, due to the pandemic situation, we will move it to the next year, 2021. We will prepare new range of speakers who visit visit Tatarstan and visit Russia concerning this topic. Actually, this conference is an international forum, global forum in the architecture of health and world systems in this area. We invite those who build healthcare facilities and everything concerning healthcare. And this is exchange of knowledge, not only theoretical knowledge, but also absolutely practical competences. How to build it, what are the horizons of development of healthcare, what are the conditions, public space, where they feel comfortable diagnostically. And we are dreaming that this, we will also have it, the ambulatory center connecting with other centers, and people will have more opportunities to care about their health. So you go there not with fears, but having hopes. Yes, the environment determines what you use and what you don't use. There are genetic research that demonstrate immunologic plasticity. Genetics is only 15%, and all the rest is environment. If you look at animals, for example, see hedgehogs, they live for 200, 300 years. The genotype is different, but the environment influences a lot. So you can see 20 years ahead and think about architecture of health and what is going to happen in 10 or 100 years. We will speak about it later, but now we are living through the pandemic period, and due to the limitations and some planned operations were cancelled. You were doing only emergency activities. So how did it influence your activity, and how was it changed? Now we are working in a planned mode with introducing the element of infection safety. Of course, some time ago we stopped for a couple of months planned work. But as for acute heart attacks, abdominal operations, we were doing them full-fledged, with confiding to the requirements of safety for patients and doctors, so that they would not get an infection. So what number of operation you would do in normal conditions? 20%, 30%. For 2 or 3 months, we stopped planned operations. How can you gain it? How can you regain it and increase the load on the equipment and on the doctors? Now we are getting to the load that allows us to regain the expectations of the patients for healthcare medicine, and in particular Medical Diagnostic Center is working also as a business project. And you have serious investments from commercial services. You are not only state-funded, and it's a normal situation. So how low did you fall during the pandemic? Did you lose profit? Yes, we did. The opportunity, the possibilities and the facilities of our clinics suffered quite a lot. So our services are additional and supplemental for our patients. We use technologies to expand the circle of our patients, because one and the same problem can be treated differently. And patients can have the choice, and people choose a doctor or a clinic and come here. So we have a number of patients from the regions of the Russian Federation and from abroad. And for abroad patients, we have rehabilitation programs, cleaning programs. These are Uzbekistan, Kazakhstan, and the areas we do educational courses and master classes. We also have patients from them. Germany, Switzerland, America, they are the leaders in providing equipment and technologies. And patients who are rich, they have a tendency to go there. And now we have professors and technologies which are the same, or we have a long way to go. I told you already, we have to be proud that we have such an enterprise, the leading enterprise in Russia. We are striving to get into the one top in Russia. And this shows our approach. We invite the leading specialists in the world for educational programs and master classes, and the colleagues feel as at home. So it is up to international standards, and people feel comfortable, and specialists feel comfortable. What does it mean? White cover or the sharp scalpel. These are the standards. And what about the treatment and cure percentage? Is it like in Stanford? Well, actually, yes, because rehabilitation starts from the very first steps in the clinic. Some people criticize the rehabilitation. The equipment is very good, and how the person is rehabilitated. You have to take challenges. You can always criticize, but if you are moving to new successes, you should move on. Restoration. Is there a system for that in your clinic? You've operated on a patient. It doesn't mean that they are healthy. What about rehabilitation therapy? It is 50% of success. On average, after the operation, a person they have 13 hours of working on a patient, because everyone else is nutrition and sleep. We have 55% rehabilitation activities, not only pharmacologically wise, but the rehabilitation wise. Due to the existence and active work of such centers as Medical Diagnostic Center, and this is one of the best ones, does mobility reduce from cancer and cardiovascular morbidity? This is influenced by teamwork. Healthcare system and economic system, and totally it leads to increase in life expectancy. And how can you retain the personnel, because the salary is state funded, and maybe you have some bonuses, but how can you compete with private clinics which are getting more and more popular and in demand. When you provide a certain environment and it is such that children of the staff get their jobs here in the clinic, it says a lot. It says about the conditions that they are dreaming to be like their mothers and fathers, not only in medicine, whether it be cleaning, engineering, economy, medicine, in all the areas. We are glad that these professions are highly respected, and in many areas children follow the steps of their parents. So you don't have to invent anything, you just continue to provide the environment where they can self-realize, self-implement. Well, quite popular are sports, and the healthy way of life has been very popular during the recent decades. Many sporting facilities have been built. Do you see the effect of this? Are the cardiovascular diseases getting a lower percentage? You have the concept of capital in the economy, human capital, and 98% is education, but now part of the human capital is health. What's the use of to be what's the use to be educated but not healthy? And healthy is becoming a value that is everywhere, and people are getting preventive. People are getting through preventive activities, preventive operations, and so on. So short answers. What will change in Tatarstan in 10 years and in 100 years? I hope in 10 years we will continue what we are doing today, and we will develop the enterprise spirit, and in 100 years go to space. Silicon Valley, Tatarstan is the territory of opportunities. Where is the point of space in Tatarstan? Where you live? What is the power of Tatarstan? What Tatarstan is lacking? So many people are lacking. So many things are lacking. You're just thinking. I'm thinking about your question, because what we are having today is a great success, a great achievement of our management, of our parents. And when you asked about that, I was thinking that we should be thankful and we respect what was done before us and continue. If you had to go away from Tatarstan, what would you take? Check, and good emotions, so that I can share and tell about the spirit of Tatarstan. Do your children live in Tatarstan, or are they going to live here? Yes, of course, absolutely. Where you were born, you live there. What young people can teach others? To reopen old things anew. You look at the book that you previously read and see it in an absolutely different way, like a new discovery. What you can teach young people, the main advice to young people from Rustem Khayrullin: hard work and learn. Thank you. It was great. Thank you very much.